Not. Yeah. Hello. How are you doing? All right, I'm just gonna check to make sure we've got the right patient. Can I get your name?
Yes, I'm Miss Irma Willis.
Oh, hi Irma. I'm gonna close this. Do some quick hand hygiene. We've just got a sheet of paper to record all this stuff.
Alright.
Let me see, we got some gloves here. I'll just put them on before we get started. Do you know where you are?
Yeah, the hospital.
Sorry. Oh my gosh. Yeah. Do you know the date?
Let's see, it's Friday, February 4th.
February 4th. Good. 2022?
Yes.
Awesome. And do you know why you're here?
They told me I got pneumonia.
Pneumonia? All right. I'm just going to take a look. All right. And do you know how old you are?
65.
Awesome. We got the MRN, so we checked that with the date, so we're all good there.
Nice.
And do you have any allergies?
Nope.
All right. And I'm taking this moment, just making sure everything's safe too while we're talking to her. We've got the blood pressure cuff. We've got suction. Do you mind if I bring your bed up a bit?
Oh, that's fine.
Awesome. All right, so we're going to take some time to do a full head-to-toe assessment on you, starting kind of up here and moving our way down.
Alright.
All right, but would you first remind me why you're here again?
Pneumonia.
Pneumonia, okay. And would you like to tell me kind of where the pain is?
In my chest.
In your chest? And out of 10, how would you rate it?
Probably a 5.
Okay, and let me just make sure I explain it. So 1, no pain. 10, like you've been hit by a vehicle.
Yeah,
5, perfect. And what would be a more like acceptable range for your pain?
Oh, a 3 would be great.
A 3? Okay. Well, I'm sure we can kind of get closer to that, you know? All right. So I'm going to start, and we're just going to make sure your face is symmetrical. Do you mind if I remove your mask for 1 second?
We'll do pretend.
Yes, perfect. All right. Give me a smile. Perfect. Awesome. And I'm just going to feel your head, make sure we're all for patency, looking at sutures, nothing crazy. All right, we're good. I'm going to, where's that thing? Oh, looking for the pen light. Here we go. All right, I'm going to take a look at your eyes. We're going to use the Perla assessment to kind of just see and make sure everything is looking good. Awesome. And kind of off the top, we can kind of see that the pupils are dilating appropriately. And I'm going to check for accommodation, so just follow my finger. We'll do the other one. I'm going to make it a bit easier. Perfect, awesome. And kind of while we're here, this is what I was going to say. We're already kind of looking and making sure that the skin looks appropriate for the race. It does, and there's no obvious lesions anywhere. And do you wear glasses?
Yeah, I just have them in my purse.
Oh, good, but can you see pretty well?
Yeah.
Reasonably well? Nice. Do you wear any hearing aids?
No.
No? Good. All right, and I'm kind of going down now. And we're kind of looking at the neck, checking to see if there's capillary refill up here. We're looking good. Do you mind if I kind of also, we're about to kind of get to this section a bit, if I kind of bring your bed up a bit just so we can do kind of a assessment. This one's got some creepiness. And I don't think she's going to fall, but I'll bring up 1, because 4 would be a restraint, but 3, we're in good territory, so you know what, we'll bring up the other one in a second, but let's pretend this one's up still.
Right.
So I don't do anything weird. Okay, so I am going to examine your lungs now.
All right.
So we can kind of we can do your back first and your like chest, or we can start at the chest and do your back.
Let's do back first.
Okay,
See
cool.
a little hand up here?
Yes.
All right. Here we
Thank
go.
you. So I'm kind of going to do a formation where I do like that. Are you all right if I just unbutton this, or have we been kind of leaving it up?
You can unbutton it.
Okay. I don't want to make sure I'm doing anything. Just going.
Of course.
All right. All right, breathe in. Breathe out. Perfect. And I'm just listening kind of on inspirations and expirations. I dropped a little low on that one, so we'll put it there. And I can definitely hear the wheezing and the rasping.
Yeah, that's that pneumonia.
Yeah. And how long have you had it for?
Let's see, about 3 days ago when I started to feel this way.
3 days. Does anything relieve it? Or is that more what we're looking for?
Painkillers help a little bit.
A little bit? Okay. So now we're at the front. I'm just going to unbutton this a bit.
Yeah, that works.
And we're going to start with our cardiovascular assessment. So we're going to do 5 spots. We're going to kind of like descend.
All right,
okay?
sounds good.
So here is our first one. It is the aortic. And then we're going to kind of go over a bit, and we're going to do the pulmonic. And then I'm going to kind of just get under.
All right, we can go from underneath down here if you like.
That'd be better. All right. And then we're going to do Herb's Point. Sorry, just get a bit higher. Just picking up on some lower quadrant noises. And then we're going to the tricuspid. And then mitral. And I'm hearing that S1, S2, the lub-dub sounds. So it's sounding appropriate.
All right.
Yep. Now I'm going to do your lungs.
All right, sounds good.
Yeah. Sorry about that.
Oh, that's all right.
Yeah. But the heart was sounded good, rate was sounding regular. And I'm going to do kind of like an S formation.
All right.
And I'm just going to listen on inspirations and expirations. And this one I'm going to kind of come in on the side.
All right.
I'm just going to move a little more immediately, see if we can hear anything a little better. All right. This side.
All right.
And then descend to the. No, move up, sorry. Picking up again on some. All right, and I'm listening on your inspirations and expirations. Awesome. All right. And now we have reached kind of the stomach area, or the lower area. So we're gonna do I'm gonna listen, and then I'm gonna kind of palpate around.
All right. Got so many snaps on these things.
Yeah, let me come around. Sorry. And we're looking kind of for lesions, anything kind of weird. But the skin's looking perfect. So. All right, and I'm going to do the 4 quadrants.
Yeah, we'll fix that for you.
Awesome, thank you. All right. And they sounded good. Oh wait, I'm gonna palpate.
Good.
Just gonna kind of feel around, see if there's any hardness here. It's feeling tender, which is good. And when was, okay, now we're done.
All right.
That was the fourth time I said that. So, I'm gonna watch the phone, make sure I don't hit it. And when was your last bowel movement?
I think day before yesterday.
Day before yesterday. And have you had any issues voiding?
No issues voiding.
No? Good, good, good. All right, so now we're gonna look at the arms. So we're just kind of looking down, looking for any lesions, looking at skin color, making sure there's no like weird blotchiness or anything like that. We'll kind of just feel the brachial pulse, just make sure everything's feeling good. Yeah, we're getting some good feelings there. So that's probably a +2 pulse. So that's appropriate. We'll feel the rating ones. We're kind of looking at the hands, looking at the nails. We're going to assess for capillary refill. And that is under 3 seconds, which is good. Second, we'll probably come back and kind of do your vitals up there. And now we're going to, oh, we forgot one thing. I'm going to have you squeeze my hands just to kind of test for the neurologic function. Nice, nice. And now push down on them. Awesome. This one feels a little stronger. Maybe it's just where I'm standing. All right, now pull up. Awesome, and that's super equal strength, so that felt good. Now I'm going to take a look at your legs, if that's all right.
That works. I'm sort of all tucked up.
Oh, I know. I know. So again, we're looking for any weird skin things. I'm not seeing anything there. We can kind of feel for the popliteal pulse back there. And then we can feel kind of for the pedal pulse here. I just want to make sure, we asked about your allergies, right?
Yes, that's correct.
There were none, right?
No
Okay, good.
allergies.
Then we'll feel this one. And kind of with her legs and with her arms, we weren't seeing any obvious edema, which is good, you know. We didn't see any third spacing with like the respiratory stuff, or not third spacing, excuse me, any like raspiness or any of that stuff. All right, I'm gonna have you push down. Again, we've got equal strength, and then pull up. Nice. All right, and now I'm gonna do some quick vital signs on you.
All right.
And both of the pulses felt strong, so +2, appropriate, no bounding.
That light
Yes.
is right in your eyes right there.
It's blinding me.
Those things have been a pain all day. Every nurse has come in and struggled with it.
Hopefully it's a lot of fake nurses. All right. I'm just going to kind of pull up under here. So 97.2, so we're within range. I'll write that down. All right, and we will use your left arm for the blood pressure. Awesome. Oh, it's right here. Listen at the brachial artery. Pump it up to around 170. I'm going to check it just one more time. I got 115/70 the first time. So that's super good. All right, 115/70. A nice, beautiful one.
All right.
As they go, you just put them.
And we're also noticing that she is using the nasal cannula. It's not plugged in. Maybe when we're taking these oxygen saturations, we could take note of that. Maybe I'll take it there. And now I'm just going to count your pulse. I'm going to use these two fingers. Oh, awesome.
I died.
Yeah.
No, I do all that. I can make comments. Sounds good. Yeah.
I just found out I had that other university that's here on the weekend, so you can close that side, but they did it. This side or that side?
All right, and I also counted her respirations. So we had 18 respirations, and the heart rate was 76.
It doesn't mean we have to do that.
See, oxygen. 90. Perfect. So that's a little low. 91. Okay, we'll record that.
Yeah, that's what it was.
But at an elevation like this, you know, you just never know. Yep. And it was a little tricky finding the pulse, but once we found it, you know, things were rolling. But it still sounded pretty good, so it's still a plus too. And now we're going to ask about kind of the psychosocial aspects of this. So how do you feel all about this?
Well, you know, no one likes to be in the hospital. I'm from out of town, from Louisiana, so I'm here
okay.
visiting friends in Salt Lake. So I'd like to just, you know, get home to my husband and my dog and out down south.
Okay, yeah. What brought you up to Salt Lake?
I got some friends here. We've been friends for, you know, 4 years, so we come visit each other now and then.
Oh, nice. And what are your goals for today?
I mean, I would love to get up and walk around if I could. I'm just so tired of this bed.
Yeah, I know, it gets pretty stiff after a while.
Right.
And who do you live with?
Well, normally I'm home with my husband in Louisiana.
Okay, nice. Any kids?
No, no kids.
No, okay, awesome, perfect. That is all for the assessment.
All right.
We're just gonna make sure everything's safe. We'll leave one down. Make sure we have everything here. We'll do some hand hygiene. Check that out first. We got our vitals right here, and we are all good. All right, you let me know if you need anything.